It was a historic moment that day in November of 1913 when, having traveled from Williamsville, New York, 3 Sisters of St. Francis of Perpetual Adoration stepped off a train in Charleston, West Virginia. They were on a religious and medical mission that no one imagined would last 100 years and cross from one century into another. Yet for generations, through times of war and peace, depression and prosperity, tranquility and turmoil, the people and the mission of St. Francis Hospital have been significant parts of the people and the history of this valley.
I think we started from the beginning. We're the only religious affiliated hospital in the community, and I think we brought that faith and that faith in God to healthcare 100 years ago, and we've carried that tradition forward over the century.
There was a passion for patient care, and that it was tied to the ministry, tied to the fact that this was a faith-based community hospital that was, started in 1913. And that culture is something that takes generations to build.
And I think that puts us all at ease, so that when we're delivering care, we know that it's the care from the heart. And that's what compassion is and caregiving is about, is care from the heart.
2 historic events occurred in 1913 and 1914. On November 19, 1913, the old Laidley homestead at 333 Laidley Street was purchased. And in 1914, the hospital opened its doors to its first patient, an orphan girl, and celebrated the birth of the first St. Francis baby just 12 days before World War I broke out in Europe. The St. Francis School of Nursing opened and would graduate skilled nurses for nearly half a century until nursing schools transitioned to college-based programs.
Oh, the nursing school was wonderful. It was the best in Charleston at that time. We were like a family. It was a small class, and so we kind of were like sisters at the end. We had lived together for 3 years.
As cornerstones were laid for a new building in 1916, and the first nurses graduated in 1917, the United States entered World War I. And in 1921, as the Sisters of St. Francis were recalled to New York, Sisters of St. Joseph of Wheeling sent 5 nuns to operate and manage the hospital, beginning a collaboration on medical care and spiritual service that continues into the 21st century.
When I came here in 1996, I came here as the Chief Operating Officer, and very quickly after being in management here for a very short time, I realized the culture that existed here at this hospital was a culture that was cultivated by the Sisters of St. Joseph that had been in place for many, many years.
Through the Sisters of St. Joseph, the first formal medical staff was formed in the 1930s, and the keystone put in place for decades of extending Christ's mission of healing with justice and charity toward the sick and all who care for them.
When I was a student nurse, I can remember when the DPA, that was Department of Public Assistance, what is now Medicaid, when that would run out at the other hospital, they would call us and send their patients here. We would take them for nothing. I mean, the charity work that the sisters did was unbelievable.
I think one of the things that makes faith-based care special is that it's rooted in something more than ourselves. It's rooted, again, in that call that every person is sacred and everyone deserves dignity and respect and care. And that's what guides faith-based health care. And it's rooted in some form of a religious tradition, is faith-based.
But times were not always good, and the going wasn't always easy. In the Great Depression, for instance, no patient was turned away. The nuns would enter all charity care on their official hospital ledgers as care provided by Our Dear Lord. During World War II, Korea, and Vietnam, national manpower demands drained Charleston of its nurses and doctors, leaving hard work behind for the sisters, volunteers, and medical personnel who remained.
When I started here, we had sisters actually walking the halls with some habit, but it changed very, very quickly. That hasn't changed. We still have sisters here in the halls. As far as nursing, we wore white uniforms.
but bridges were boldly crossed. Before there was a Brown versus School Board ruling by the Supreme Court, St. Francis Hospital became the first hospital in Charleston to become integrated. There were new building additions. A second unit was added to the 1916 building in 1924, a third to handle demands of the nursing school in 1939. During an era of racial tension in the early 1950s, 20 white nurses walked off their jobs when the nurses refused to discharge 3 black nurses. Substitute nurses were flown in from other communities, and the 3 black nurses continued their employment. St. Francis Hospital expanded its services in 1967 with the opening of a 116-bed extended care unit. This was followed by a new East Wing that was constructed in 1971 beside the original red brick hospital. A new West Wing was constructed, and a medical office building and parking garage were added in 1980. The one-day surgery center medical office building was constructed in 1985.
I went into healthcare initially because I wanted to take care of the sick. And I feel at St. Francis, that's what we get to do. We get to say a prayer in the morning. We get to give healthcare as a ministry. And while times have changed through the years with nursing and healthcare, that has not changed at this facility.
With ultra-modern equipment becoming commonplace in the 1980s, St. Francis was on the forefront in becoming the first in the area to open a skilled nursing unit in the 1990s, unveiling a new state-of-the-art emergency department, relocating its physical therapy and nuclear medicine departments, and purchasing 400 Court Street to add advanced women's imaging services in 2000.
Advanced technology is very important for patient care at St. Francis. We have the state-of-the-art equipment in the radiology department and is critical for patient care.
As St. Francis Hospital entered a new age in modern medicine and high-tech equipment, the facility was ahead of the curve with the St. Francis Hospital Center for Pain Relief, offering advanced, minimally invasive treatments to patients for a life free of pain and addictive medications.
Well, in the last 15 or 20 years that I've been here, we have seen great advances in the technology of treating pain. Devices have gotten smarter, they've gotten more efficient, given better outcomes to patients, and the safety has improved dramatically.
Also, St. Francis Hospital's orthopedics has been recognized as providing excellence in quality by CareChecks, which provides a continuum of quality awards spanning from national to local levels of achievement. CareChecks Medical Excellence and Patient Safety Award for Major Orthopedic Surgery. National Award, #1 in the state, was presented to St. Francis Hospital. The hospital also earned CareChecks State Award and #1 in the market in 2010.
We do heart cath, angioplasty, a lot of orthopedic surgery. We have everything to take care of the patient here.
St. Francis's Advanced Women's Imaging Center provides a wide range of services, including full-field digital mammography, which provides a number of image-enhancing tools for more accurate diagnostic readings. In 2007, St. Francis was purchased by Thomas Memorial Hospital, forming Thomas Health System. Bringing the 2 hospitals under the umbrella of the Thomas Health System allowed both hospitals to bring innovative and cost-effective healthcare to the Kanawha Valley.
What St. Francis, we're able to combine our patient care and technology very well. Even though we are a smaller hospital, we're still advanced. Our administration and the Thomas Health System Board has made a commitment to St. Francis Hospital. They've made an investment in our technology here. We have to have it to advance and really be at the top level of care. And I think we're doing that. We're adding electronic records, we're adding digital imaging. We've done those things, and that keeps us up to date with the big hospitals.
The partnership between Thomas Memorial Hospital and St. Francis Hospital means providing advanced technology to a larger community, with access to the highest quality of physicians, nurses, and support staff in the Valley. Reinvesting the money back into the system so each hospital can grow and flourish means a brighter future for the health and wellness of friends, family, and neighbors.
St. Francis is a key to this community. It's not just a tradition. St. Francis has been here literally before the community was a community. It has been the location where people have been born, unfortunately where people have died, but it's been part of the fabric of our community. It's hard to imagine how we would have attracted the kinds of physicians, the kind of healthcare services that we currently have in the area if we hadn't had St. Francis here all these years, slowly but surely bringing in those kind of doctors, bringing in those kind of technologies, and serving the people as well as they have.
In 2011, the Thomas Memorial Hospital Foundation Board of Directors approved the addition of St. Francis Hospital to the foundation, creating an opportunity for the community to make tax-deductible charitable donations to both hospitals. Known as the Foundation for the Thomas Memorial and St. Francis Hospitals, the new foundation will raise funds through community support to financially assist the efforts of Thomas Memorial and St. Francis Hospitals to further improve the health, education, and well-being of the citizens residing in the service area.
I am most proud to be at St. Francis because when you go out in the community, I stop at the grocery store on my way home and someone looks at my name tag and they say, "You're one of those angels." And you think, yes I am, yes I am. Thank you. Thank you for saying that. Thanking you for making me realize I am one of those angels. The community perceives this hospital as faith-based, which we are, but they perceive us as a caring people that care beyond means, and we do. We take care of our patients by caring. That doesn't mean we don't have the knowledge, we don't have the new technology, we have all that. All of the hospitals in this area have that. But what we have is we care so deep.
All of these accomplishments bode well for the future of healthcare in the Kanawha Valley and the future of St. Francis Hospital, always meeting the challenge of serving a new generation of West Virginians in keeping with a Catholic philosophy of healthcare.
And I think the things about St. Francis is that they were very attentive to all the patient's needs. And I'm talking about not only physical, but spiritual and mental.
The best thing about practicing at St. Francis, I think, is at a smaller hospital, you really get to know our staff, our nurses, our ancillary service and professional people. They're great here, but you really get to know them, and they know you, and they understand what I want to do with my patients, and so it just makes the flow of care very smooth. Our patients realize that the nurses really know what they're doing, and they appreciate the care that they get, and that's why I like to practice here.
What makes each day great at St. Francis for me is the people that work here. We've encountered a lot of change over the past several years, and the folks that are here at St. Francis are the folks that really, really want to be here. They are the folks that are committed to our mission with our focus on Christ healing love, and these folks have stuck around. They've been here through the hard times, the good times, the times of change, and they're the heart of St. Francis Hospital. And it makes me proud to be here, to see these folks in action every day. I love it here.
We are here to please the patients and to take care of them. And if they're wanting something special, we try to get that for them. And we're just trying to make them happy while they're here.
I am most proud of St. Francis Hospital because of our leadership. That is so awesome, and it just trickles down to all the employees, and it makes for a good working environment.
Everybody works as a team to make things work. You have to work together, from the nursing staff. I have to get the medical supplies in for the patients, for the doctors and the staff, but everybody works as a team, and that's what it takes.
St. Francis represents history in a way in our community, in that we've been here for 100 years now. We are very well recognized as a leader in healthcare in the community. but also the fact that we've sustained throughout time our ability to serve patients through thick and thin, through wars, through problems that we've had in the community, that we've always been here to support the community in terms of providing quality health care. I think that's one of the chief reasons that I think we're important to the community here in Kanawha Valley.
It is the people of St. Francis who proudly continue the faith-based, compassionate, and quality care of this hospital. And this strong tradition of a century continues into the next century with faith in healing.
We stand on the shoulders after these 100 years of everyone who has worked here and those who still continue to work here and providing that kind of care to our patients. So we've been blessed over these 100 years to have people who want to commit themselves to that, no matter what their faith background is.